Ministry of Health of Ukraine. Krok 2. Medicine. Year 2020. Number 045. A 19-year-old young man complains of cough with expectoration of purulent sputum in amount of 100 milliliters per day, hemoptysis, dyspnea, increased body temperature up to 37.8 degrees C, general weakness, weight loss. The patient's condition lasts for 4 years. Exacerbations occur 2 to 3 times a year. The patient presents with malnutrition, pale skin, cyanosis of the lips, drumstick, clubbed fingers, tympanic, percussion sound in the lungs, weakened respiration, and various numerous moist crackles in the lower pulmonary segments on the left can be observed in this patient. In blood, erythrocytes 3.2, 10 to the power of 12 L, leukocytes 8.4 times 10 to the 9 L, ESR 56 mm per hour. On X-ray, lung fields are emphysematous. The left pulmonary root is deformed and dilated. What is the most likely diagnosis? A. Suppuration of the cyst in the left lung. B. Chronic left-sided pneumonia. C. Chronic abscess of the left lung. D. Left-sided pulmonary cystic dysplasia. E. Multiple bronchiectasis of the left lung. Bronchiectasis is a long-term condition where the bronchi become dilated, leading to a buildup of excess mucus that can make the lungs more vulnerable to infection. Symptoms of bronchiectasis: persistent productive cough, wet cough, often lasting months to years. Most common, shortness of breath. Most common, weakness, fatigue, weight loss, fever. Hemoptysis, pleuritic chest pain, crackles, raunchy, scattered wheezing, and inspiratory squeaks. On auscultation, digital clubbing, cyanosis, nasal polyps, chronic sinusitis. Lung abscess is a suppurative lesion of the lung tissue caused by the common bacteria in the oral cavity and the upper respiratory tract. It is defined as chronic if the course of the disease lasts more than 3 months. Congenital cystic adenomatoid malformation, congenital pulmonary airway malformation, is a benign lung lesion that appears before birth as a cyst or mass in the chest. It is made up of abnormal lung tissue that does not function properly, but continues to grow. Cystic adenomatoid dysplasia of the lung in a newborn is characterized by acute progressive respiratory distress secondary to mediastinal displacement and pulmonary compression as a result of the expanding cystic lesion. Pneumonia is an infection that inflames the alveoli. They may be filled with fluid or pus, causing cough with phlegm or pus, fever, chills, and shortness of breath. In chronic pneumonia, it lasts at least 6 weeks. The chest radiograph usually shows diffuse or focal shadows. Pulmonary cysts usually contain gas. They can develop over time. They may indicate an underlying medical condition. Congenital parenchymal lung cysts are usually thin-walled, unilocular and singular, usually involving one side and more frequently involving the lower lobe. Multiplicity or multilocularity suggests an acquired cause, most commonly infection, whether primary or secondary. Cystic fibrosis also gives rise to multiple cysts. The answer is E. Multiple bronchiectasis of the left lung.